welcome. And that's really good. Good afternoon, folks. That was just it telling me that it is being recorded this week. I'll speak to that in a minute. But welcome everyone to our town hall for Thursday, the 21st of May. I'm Bruce Squires, Vice President, Women's and Children's Health, and President McMaster Children's. So thanks so much, everyone, for joining us today. This is, I think, week number 6 of our virtual town halls that we've been doing weekly with the group, and I've so appreciated those. I am reflecting as I look at myself. I can tell that if one thing's changed over this time, my hair has gotten progressively worse and less manageable. I'm trying to work on my wife tells me to try and figure out the Justin Trudeau sort of suave flow through, and I haven't perfected it. So maybe we can get guidance going forward. So so I want to get in fairly quickly into this week's town hall, because we only have half an hour exactly. Still getting a sense from folks in terms of your responses to the survey that there's some value in the town hall. Fewer people are filling it out. Few more folks saying, you know, maybe we're getting ready to be able to move to something like twice a month or even monthly. So we're going to keep watching that. Look forward to your thoughts. But those who responded, we're still in sort of the 90% range in seeing it being valuable. Again, with respect to learning, one of the comments was, I've been unable to attend due to my inpatient role commitments. The last 2 weeks, the webinars have not been recorded or available after the fact. Quite frustrating, considering it should be well known staff have competing patient demands and would need to access at a later time. Absolutely known, absolutely my fault for not recording those. I made the mistake both times, and I apologize. We fixed it because we've given the responsibility to Michelle, so she'll get it right. So we are going to be taped now. So try and, if you can, if you know folks that haven't been able to watch, encourage them that we will have the link up within a day at the most, and folks will be able to access. In terms of suggestions for topics, there were two, and I want to address those right off the bat. One was to learn a little bit more with respect to what we're calling ramp up or the gradual resumption of services. And so there has been activity on this again in the last few days, and so I want to address it quickly with this group. Across HHS and specific to MUMC and Ron Joyce and the Children's Hospital, Women's and Children's, we have developed very concerns for an initial stage of ramp up. And we have approval for those plans to go into effect on Monday, the 25th, from HHS. Going forward on Monday, still subject to approval from the sub-region and the region of the Ministry of Health, which we expect to happen tomorrow. So because we expect it to happen tomorrow, we are planning for this very gradual ramp up on Monday. The core of that ramp up on the procedural and surgical side involves one additional OR at the MUMC site, plus another block and a half on a few days during the week. So that's a very small number of patients with probably around a two inpatient impact due to length of stay, et cetera. So it may add sort of 2 more inpatients. As it relates to the ambulatory side, again, a very small additional volume in this initial stage of ramp up of on-site visits. So work is going on today to ensure that we've got kind of the last stages of that planning. The number of patients is, for the entire site, is less than, I think, an additional 300 patients. spread across, dozens of clinics, that's a relatively small number of patients. What will happen, again, subject to approval, is that we will then have the opportunity in the first period of time, and I suspect it will be a couple of weeks, to see how that goes, to see if we have any challenges with the additional, if you like, potential pressures associated with the ramp up in terms of particular things like social distancing or physical distancing, PPE, the flow of patients through the clinics, any draws on cleaning supplies as well as our cleaning staff, and any impact as it relates to pharmaceuticals, to drugs or otherwise, some of which remain in tight demands. So the core message as it relates to that piece of the ramp up is very, very conservative, very small, but if it goes well, then we would look to incrementally move forward. The second piece of ramp up relates specifically to Ron Joy's services in autism and developmental pediatrics and rehab, and a little bit in mental health. We're doing, with the direction and approval from the ministry, plans have been developed for a further ramp up in virtual care to go into effect on June 1st. So with fairly short notice, and that is going to involve some recall of folks that have been redeployed and working in other areas, many in screening, to come back and do some additional virtual care. At the same time, we also know that we've been given the opportunity to do some planning around the resumption of in-person on-site visits related to those populations. So that we don't have a date on that yet, okay, as to when that would go into effect. That planning is starting. So as soon as we do have dates, then we'll share that directly with you, as certainly as individuals as well as the group. So I hope that's helpful with respect to this initial stage of the resumption of services. And again, anticipating approval tomorrow, but it's certainly possible, given how much things change, that we won't get that from the region or from the sub-region. And so if we don't, then we may have to adjust, and we'll communicate that. So that was, in terms of topics, one topic for us to pick. There were 4 or 5 suggestions of that topic, so I've spoken to that. The next suggestions, I'm really pleased. A lot of folks asking for us, I'll read a couple. So I'm happy we will be discussing the COPE line. More staff need to know that they have support, and you don't need to be in crisis to reach out for support. Stress management. Help me with coping with how friends and family are being, and friends and my family are being influenced by the pandemic. Reintegrating staff. And so all of this, and by the way as well, really strong feedback on our first guest, Martha Fulford. So all of this led us to, and I'm really pleased to introduce and to welcome Michelle Cassidy to come to speak to us. And so many of us already know Michelle from her close work with so many of this group, but she's been playing a very, very key sort of corporate role as it relates to the COPE line and support. I'm not going to say anything more so that Michelle can speak to it, except again to say thank you so much for joining us, Michelle, and I'm now going to turn it over to you.
Awesome, my pleasure. Thanks for the opportunity to speak to this group. It almost feels in some ways like your site is part of the birthplace of this service, because I'm just looking at all of the people who've been involved in the development or operations of the COPE line, and most, if not all of them, are coming to us from your site. So really pleased just to have a few minutes to share, and I don't know the timing of yours, so give me like one of these when you need me to stop. but wanted to just take a minute to share about the COPE line, which is a peer support line for all of our staff that can be reached through extension 43333. I see a few of our COPE call takers on the line. I've just been scrolling through, so I certainly see that Aaron and Samaria are on the line. So they would be two of the amazing people that are prepared to take your call. We have a multidisciplinary group that come from Ron Joyce 3G, as well as the pain clinic at Mumsy, and some other staff that have been redeployed to this effort. We're operating 24/7, prepared to listen to staff, recognizing that for many of us, we're living quite a different reality right now than many of our peers may be, our families may be, our friends. I know a lot of my friends are teachers and their reality looks very different to ours right now. So it can feel a little bit isolating, I think, for many of us to try to reach out to our typical places of social support when people's experience may be dissimilar to ours. So peer support is a great opportunity for us to feel a little bit less isolated, to be able to connect with each other, people who are going through a shared experience, and really just find a landing place for some of our concerns, to experience validation, for us to, get some things out unedited in a way that doesn't need to look fancy or precise, but just to be able to speak how we're feeling, how we're doing, and how we're coping or not coping. And our peer supporters are there to listen and to offer whatever help we can. What else would be helpful for folks, Bruce, to know? I'm not sure all the questions that have come in, but if there's any things that we can do to help make it feel more accessible, we'd really be interested to do that and achieve that on the conference today.
Thanks very much, Michelle. And folks, if you do have a chat question you want to submit, we've got time. Use the chat box. But I'll certainly highlight, Michelle. I mean, one of the folks people have asked you to address is just recognizing the struggles that folks have at work, being at work during these times. In addition to the COPE line, what kind of advice would you offer folks to kind of think about right now as how they can, how they can help to support themselves and each other?
For sure. I think a lot of our messaging is a bit around leaning in with some self-compassion and just recognizing this is not a time where we're going to get everything perfect or right, but to recognize we all are operating with our limitations and to give ourselves a little grace. I know when we're going around the units, because we're providing on-site support right now, I think a lot of people just struggle with this living in the gray. And I think when we were all prepared for this to be perhaps a short burst, originally that sprint that we were talking about, I think we had amped up our resiliency and we felt like we were going to be able to navigate it. But now when we start to shift into this marathon or the more extended period of time, it might feel like our resources are not going to see us through. And so we talk about, continuing to bolster our resilience and find those spaces that we can do that. Seeing where there may be boundaries that we can set in our lives that we don't perhaps have already, making those spaces, finding the time, learning to say no. And even, I think sometimes for healthcare, the hero motif that's out there in the community can feel like quite a burden when many times we feel less than a hero. So being able to, to hear that perspective, but also to let it go at times that it's not serving us well. So I think, really just leaning into the humanity of this period, taking some time to support yourselves and each other. I really think that the peer support piece that we're hoping the COPE line can offer, we want that to feel like a gift to our staff and like a recognition that you're all doing some incredible things, but also having some really tough experiences. And we want to be able to walk alongside you and share that. And even just, I think often in the sharing of pain, it can help it feel a little lighter.
And Michelle, would you have any one example that you'd maybe call out where you could, as maybe an illustration for folks of how you've heard back or seen how kind of relying on or taking advantage of the resilient supports has helped someone through a challenging time?
Certainly. I think we can talk about, we're doing a lot of work at huddles at all of our sites, but even on the line, that sometimes we think about, supporting our resilience as overly complex. And sometimes it is as simple as slowing down and giving ourselves permission to breathe. So even when we, are taking the temperature at a huddle, for example, asking people to check in with themselves, and then we do a brief 30-second practice of something like 4-7-8 breathing, and then have people check back in with how they're doing. And just the surprise that many people experience that something so simple and so brief can really reset us and help us to feel more prepared to engage in what we have next. So not to, overcomplicate it or think it has to be an hour long, but sometimes just those micro moments can make all of the difference if we're weaving them in throughout the course of the day.
That's awesome. Thank you, Michelle. So if you're able to stay on the line, what I'm going to ask you, maybe give you a signal then, is if I stop 2 minutes early, can I ask you to think of an exercise that you'll lead us through for a few minutes as we close off the call and then go into the rest of our day?
Sure, absolutely.
Awesome. And so what I'll do now as quickly as possible, folks, as we try and do every week, is to read through a number of the questions to use as an opportunity to answer and to share information and to promote two-way dialogue. So a couple of people, it is really an accident waiting to happen for people to have to walk through the parking garage the way it is set up, especially now that cars don't have to stop on the way in and out. And related to that is, can we please do away with the screening tool now that we're aware of the risk factors and when to stay home? This will also allow you to open up the red section of the parking lot so there are actually spaces for everyone to park. So I have to be frank, there's no plans to completely do away with the notion of screening ourselves formally. However, that doesn't necessarily mean that has to involve in-person screening. So we're actively looking at, for example, continuing to use the online application, because we know going through processes every day can be very important. We know that in healthcare checklists. But we are investigating whether we're getting to that point, like some other institutions, where we don't also need to have a place where staff members go through a formal screening process. We need to, and we're working through the last piece of that, which is to ensure that you're able to get a mask for the day, or possibly to have a mask available. Right now, there is space for everyone to park, and security, I think, have done a wonderful job of trying to help to funnel traffic and foot traffic in a safe way. But as we begin to ramp up, as is being pointed out by the question, we will see additional activity. So that is also going to force us, prompt us, give incentive to address as was pointed out here, the less than ideal nature and what could be a safety challenge in terms of the parking garage. The masks being provided, we are being provided with, are below poor quality. They do not conform to our faces and are mostly defective. So have checked in. The masks that are rated level 1 for patient-facing staff, they are all going through HHS testing and approval in terms of their effectiveness. But there is inconsistency between suppliers and how good they are, and in some cases, for sure, I'm pointing to the strap portion, right, where we've had, in particular, some challenges with straps. So by the end of the week, we should be done with that batch. I will share with folks, certainly what I'm doing, and this works for administrative folks, I am using the paper bag method so that I really have 5 masks that I'm cycling through, so that I arrive each day with my own mask. And it's you want more information about that, certainly your manager can help with that, or even reach out to me. Sticking with that sort of that area, can we please be allowed to re-enter through the front door if we leave for break or lunch? Either that, or can we please open a courtyard so that we can get outside day or night? So the problem with leaving through the main entrance, particularly as we're starting ramping up, is that we're starting to get into the lineup portion. So we're certainly sticking right now with a core principle, and this is well established, to keep staff and a patient's family kind of separated at the entrance point. However, on the second piece, we have put in place, and this question helped to prompt that I think it'll be open, if it's not today, it'll open tomorrow, that we are opening the courtyard off the corner cafe, so that that will provide the opportunity, another opportunity. It's nice, it's a beautiful day out as I looked outside, so nice to be able to step outside. And I just have to keep emphasizing, this is an ongoing, this is going to keep to evolve, right, for society as well as us. So keep the ideas coming as we look at them, and we'll keep looking to move it along. So I want to make sure I understand this. So can we please, can we please have a table or something put at the screening booths? I had this question a couple times. I thought I addressed it. So a table at screening booths in order to not have to place our lunch bags and things on the disgusting floor of the parking garage on our way in. And I certainly appreciate that. We've absolutely really closely looked at this, but the challenge we haven't been able to figure out with putting tables there, where you put your bag on the table, is that you immediately contaminate the table, and so that it needs to be washed down, and that uses up additional cleaning supplies, and also slows down the move that we know, the kind of the flow that we know to staff is very, very important. Even with the stopping to wipe hands, I've had comments on that. So at this point, it's actually not felt that that's a great idea. If at all possible, you know, can a backpack or some other bag that you have allow you to not have to put down your bags? I'd encourage you to look at that. I appreciate the challenge, and that doesn't necessarily work for others. Again, depends on kind of what's practical. I've even put something, kind of propped it between my legs while I washed my hands, but that may not work in every case. So looked at this closely, but on balance, the advice from our experts is, no, that's actually creates a worse risk by and a challenge with respect to our supplies by using the table. A question about, my question has to do with students and in-person placements. In this case, the dietetic internship program accepted a cohort of 12 dietetic students from Brescia, currently evaluating resumes, determine their acceptance into the pediatric placement stream. Scheduled to start in-person placements in September. And they put in brackets when the second wave is predicted to hit. No, most other professions are waiting to hear about student placement as well. Can you comment yet on the discussions and timelines for when we will know when we're allowed to have students again, and what that might look like in an inpatient, outpatient, or office settings? Or if in-person learning will have to be deferred until all of this is over. So I read a detailed question, and a little bit frustrating to say, no, I don't know yet. I can at least dispel the notion that any decision has been made that it all stops. It is all done away with until the end. I can say that sort of the active thinking is gradual reintroduction. So the university is starting to gradually reintroduce beyond just researchers that have been working on purely COVID information. They're hoping next week to reintroduce some researchers working on other items that are of kind of time-sensitive nature, and for which social distancing, et cetera, can be withheld. As we actively plan ramp up, we have to address how to both provide clinical placements and facilitate continued care. So, you know, it's another one of these where, no, I can't give you the answer that says this is what is going to happen. I can give you the answer that no, decisions have been made to cease clinical placements, and thinking and working is really targeted on how to introduce in a gradual way that really core piece of what we do. I'll go back to emphasize again, you know, one of the things that makes us great is the fact that we are an academic health sciences system. We are really structured around clinical care, ongoing education, and ongoing research. And so we're not going to lose that. I'll say on my watch if that's okay. And I know on the basis of how so many of you were involved. Let me just highlight a couple of more. So there weren't too many questions this week, which again may be an indicator that you're thinking that it's time to ramp down a bit. It's unfair that NEO parents are the only ones who are allowed to sit in the lobby area. Recognizing the NEO parents have nowhere else to go, all of the other parents should have a place to take a moment outside of their child's room also. The messaging is poor, so we have adjusted that. So that space is not only reserved for neonatal parents. And so you'll notice that on the sign outside of 2G. Can we please put some garbage cans for mass disposal in the underground near the staff entrance and exits? Also maybe prop the doors to and from stairwell 42 so we don't have to touch the handles. So there is a garbage can in the red elevator entrance at parking level, and two just outside of the doors as you exit, as you head into the parking garage. And we've ordered another to place near stairwell 42. We cannot prop the doors open. That's a fire hazard that folks will understand. But as always, we place, and there are sanitizing stations. So the notion is to not to never open doors, but it's to clean your hands after you touch something. So as long as you clean your hands thoroughly after you touch something, then you're appropriately applying all of the key principles. So I'm going to close on that message again, the one that Martha Fulford has hammered into me: wash your hands, wash your hands, wash your hands, and wash your hands again every chance you get. And now I want to thank you, as I turn it over, I want to thank you again for this week's session, and most importantly for every single thing you do. I'm going to pull three, and then it's coming to you, Michelle, real quick. I'm pulling three questions here, and that's because we've got a number of M&M Meat gift cards, which allow us, that we're going to provide to the area from whom the question is drawn. It doesn't have a name. So Yana Fresco, who's an RN at PICU. Oh, look at this, from Troy Farncombe, one of our imaging physicists in nuclear med, which is awesome. And from Merle McDonald in OT and developmental pediatrics. So those three areas, congratulations on winning on the draw. Thank you all, and thank you so much, Michelle, for agreeing to provide this session. And now can I turn it back over to you to help us to close out and feel energized?
For sure, absolutely. One of my typical strategies is to every day map something in my calendar that brings me joy. So I want to thank whoever Wendy is with the picture of your dog, because dogs is one of the things that brings me joy. So your picture has been doing that throughout this session. And I will close probably with my favorite breathing technique, which is 4-7-8 breathing. Some of you, if you've come to the Working Mind, you may be familiar with it. I like to choose this one because this breathing technique also helps people who have trouble sleeping. So if any of you on the call today are people who struggle with sleep, 4-7-8 breathing may also help you with that. I also feel very privileged to be doing this without a mask on right now, because deep breathing with a mask on is a lot harder than I anticipated. So here we go. I'm going to just do 3 rounds of deep breathing, and then I'm going to close with a brief poem that we've been using in our huddles this week. So I'm going to ask for those of you who are sitting comfortably, if you could just have your feet flat on the floor, and then maybe put your hands on your belly, because this is where you will want to initiate the breath from. Good news is this is where you want to look 9 months pregnant. So just stick your gut out. None of us care. We can't even see anyway, so it's all good. So stick your gut out, and I will count for us on my fingers as well as aloud. And the way that 4-7-8 breathing is designed is you're going to breathe in for 4, you're going to hold for 7, and then you're going to slowly, slowly let the air out for a count of 8. And we'll just do 3 in a row together, and then I'll close by reading this poem. So here we go together, in for 4. Hold. And out. In for 4. Hold. And out. Last one. Hold. And out. And the poem I'm going to read is called Walk Slowly by Dana Falls. It only takes a reminder to breathe, a moment to be still, and just like that, something in me settles, softens, makes space for imperfection. The harsh voice of judgment drops to a whisper, and I remember again that life isn't a relay race, that we will all cross the finish line, that waking up to life is what we were born for. As many times as I forget and catch myself charging forward without even knowing where I'm going, that many times I can also make the choice to stop, to breathe, and just be, and walk slowly into the mystery. Thank you.
Thank you so much, Michelle. That's awesome. All right, what a great way to get us going for the rest. So thank you, everyone. Have a great rest of the day, great weekend. Look forward to seeing you over the course of the coming days and or next week. So take care.